Assalamu alaikum dear students. This is lecture of gross anatomy lower limb. The topic of today is the popliteal fossa for first year MBBS students. I am Dr. Karimullah, demonstrator anatomy department, GKMC Swabi. The popliteal fossa is a diamond-shaped structure on the posterior side of the knee joint, and it is a main pathway for the structures to move from the thigh to the leg region. It has borders, it has contents, and its clinical relevance I will discuss with you. The popliteal fossa has four borders, and these borders are formed by the muscles in the posterior compartment of the leg and the thigh. The superior-medial border is formed by semimembranosus muscle tendon, and the superior-lateral border is formed by the biceps femoris muscle of the thigh. The inferior medial border is formed by the medial head of the gastrocnemius muscle, and the inferior lateral border is formed by the lateral head of the gastrocnemius and the plantaris muscle. The floor and the roof of the popliteal fossa. The floor is formed by the posterior surface of the knee joint capsule and the posterior surface of the femur. The roof is formed by two layers, the popliteal fascia and the skin, and the popliteal fascia is continuous with the fascia lata of the leg. The contents of the popliteal fossa. Neurovascular structures leaving and entering the leg are the contents of the popliteal fossa. From medial to lateral side, the popliteal artery, the popliteal vein, the tibial nerve, the common fibular or the common peroneal nerve are the contents of the popliteal fossa. The tibial and common fibular nerves are most superficial. The common fibular nerve follows the biceps femoris tendon running along the lateral margin of the popliteal fossa. The small saphenous vein is a superficial vein which pierces the popliteal fascia and empty into the popliteal vein. The deepest structure is the popliteal artery. Now some clinical relevances of the popliteal fossa. Any swelling in the popliteal fossa. There are two major causes of mass or swelling in the popliteal fossa. Number one is the Baker's cyst. Number two is the popliteal artery aneurysm. The Baker's cyst is an inflammation and swelling of the semimembranosus bursa. It usually occurs with arthritis of the knee, usually resolve itself, but if it persists and does not removed surgically, it can rupture and can increase the discomfort on the back of the knee in the popliteal fossa. The popliteal aneurysm. Aneurysm is an abnormal dilatation of the artery. Aneurysmal dilatation of the popliteal artery has pressure effects on the structures due to tough fascial layers. The tibial nerve can be compressed and it is more susceptible to be compressed, and it presents as the leg anesthesia or the loss of leg motor function. The pulsation used to be there in the popliteal fossa and the arterial sounds are heard. So this is the main diagnostic criteria for an for a swelling in the popliteal fossa in order to differentiate it from other swellings like the Baker cyst. This was all about the popliteal fossa. It was an anatomical area in between the thigh and the leg on the posterior aspect of the knee joint. Thank you very much. Another time, students, I hope you would have followed me. Wassalam.